skin really dry and itchy. What actually happened to me?
Based on your symptoms, I think you have eczema, so let me explain more about eczema. An eczema is a form of dermatitis, which means inflammation of the outer layer of the skin. It is characterized by a variety of skin conditions that cause the skin to become dry, red, irritated, and itchy.
Factors of eczema. Specific cause of eczema remains unknown, but doctors believe it due to genetic and environmental factors. Genetic factor, eczema often happens in people who have a family history of allergies or asthma. Studies show that if one or both parents have eczema, asthma, or seasonal allergies, their child is more likely to have eczema. For genes, researchers have found that certain people with the condition have a gene flaw that causes lack of filaggrin. Filaggrin is a type of protein that can be found in our skin. The function of filaggrin is to help the formation of protective outer layer of skin and keeps out the germs. When our skin lacks filaggrin, it will cause our skin barrier become dry and weak. Next is environmental factors. Environmental factors are substances or conditions that can cause eczema to flare up. It is also known as trigger factors. Environmental factors include irritants, foods, allergens, stress, hormones, and microbes. Irritants are the substances that cause inflammation or discomfort to the body, especially skin. For example, soaps, detergents, and disinfectants. Examples of the food that can cause eczema to flare up are dairy products, soy products, wheat, and nuts. For hormones, some females may experience increased eczema symptoms when their hormone levels are changing, such as during pregnancy or at certain points in their menstrual cycle. Next is allergens. Allergens are the substances that can cause allergic reactions to occur. The example of allergens are dust mites, pollen, molds, or food. Next, microbes also can cause eczema to flare up, like bacteria, virus, and certain fungi. For someone who have eczema and they are stressed, the eczema symptoms will become worse.
Should we just let our skin like this? No, never do that. So, what is intervention and medication for eczema? Intervention of eczema. So for the first one, you can moisturize your skin at least twice a day. For example, you can use creams, bath oils, ointments or sprays. Next, don't ever use harsh soaps, detergents, or solvents. You should choose mild soaps without dyes or perfumes to avoid eczema from getting worse. Next, you should also wear cool, smooth textured clothing and make sure to wear appropriate clothing in hot weather or during exercise to prevent excessive sweating. You should treat stress and anxiety. This is because stress and other emotional disorders can worsen atopic dermatitis. The last one, you have to pay attention to foods that might trigger symptoms and try to avoid them. Next, medication for eczema. The first one, you can use creams that control itching and help repair the skin. For example, is tacrolimus, Protopic, and famecrolimus, Elidel. Next, you can take oral drugs that control inflammation. For more severe cases, your doctor may prescribe oral corticosteroids such as prednisone.